Welcome to Vital Living Forum. Today we'll be talking about mood disorders in older adults. We all play an important role in helping older adults get the mental health care they need, but access to mental health care services can be challenging for this population. We don't want a lack of information or access to be a barrier. So, joining me today are Dr. Daniel Paulson with UCF Older Labs, Dr. Ashley Jennings with Bethune-Cookman Gerontology, and Dr. Sheila Baez-Torres with K2 Medical Research. Welcome to you all. I want to start out by getting sort of a baseline with an understanding of what exactly mood disorders are and how we can know that it's a mood disorder.
Sure. So we can broadly divide mood disorders into two classifications, what we would call unipolar disorders like major depression and bipolar disorders. With the unipolar disorders, they're marked by a period of weeks to sometimes years of depressed mood, lack of interest in enjoyable activities, loss of motivation. Whereas bipolar disorders are marked by wide fluctuation in mood over the course of days to weeks, including what we would think of as manic episodes or hypomanic episodes where people take on very risky but also potentially rewarding activities, spend a lot of money, engage in a lot of very dangerous activities as well. So does that kind of answer the question?
Yeah. You know, one of the things, because how do you know what's like a bad day or a couple of bad days and what's a real mood disorder?
Everyone has ups and downs. Everybody has days or weeks when they feel depressed or blue. It's when those bad moods go on for several weeks or more that we begin to consider a mood disorder diagnosis as a way of describing the sort of entrenched cycle that individual may have fallen into.
Also, if whatever change in their mood or behavior is interfering, right, with their activity of daily living, their level of functioning, their interaction with others, I think that's what takes the edge into the wrong side and requiring a diagnosis and help. How they work with their emotions, right? Can they process and help themselves or ask for help and continue functioning versus the opposite, right?
And I would agree. Mood disorders and how, the stigma associated with mood disorders, it really makes it difficult for individuals to share their feelings or even seek assistance and resources. So it's really important that we address it very delicately and that we're informed.
You know, these days, everybody's talking about isolation and people feeling lonely. I wonder, do mood disorders increase with age or decrease with age? How does that work?
That's a fascinating question. It seems our best data suggests that there's sort of an S-shaped distribution of mood disorders over the course of the adult lifespan, peaking initially maybe late 20s, early 30s, declining through midlife, and then there's a second uptick later in life, around age 75, 80. And so there are sort of these two waves, if you will. In general, on average, the 70-year-old version of you will be happier and more at peace than the 25-year-old version of you.
And I would say that our lived experiences are definitely associated with the way that we experience our depression or anxiety. It's basically what you go through in your life will contribute to your quality of life and your mental health in general. And so I think that we have to look at our everyday, we have to look at our lived experiences, we have to look at our environment and take all of those into consideration regarding our moods as well and our overall mental health.
Sometimes I call it part of growing pains, in the sense that when you're young, you want everything now, and you're learning how to process all these wants and needs and how to get them correctly. In your midlife, well, hopefully you have accomplished your goals and you have a feeling of satisfaction. But then as we get older, you start losing your independence perhaps, health issues get in the way, relationship changes, right? So you may lose some close, important people in your life. You may need to move to a nursing home or feeling more isolated. Children grow up, so that sense of I don't have anything to do or nobody really needs me, so it may change their own perception, and that may let all this to be a set-in, probably. Mm-hmm.
To your point about isolation, there is a marked increase in suicidality, a number of suicide attempts among older men. And the best predictor of that is social isolation, and also the best treatment for that. The best preventative factor we've found is to break through that isolation and get some people back in their life again.
Absolutely. Social support is critical. Social support has all of these protective factors, and individuals that have committed family members or friends, just supportive environments, they fare better. And I think that we are able to help them in ways that are innovative if we can continue to have people around them that love them and support them.
Yeah.
Dr. Baez-Torres mentioned something that really made me think about things that are happening now with things like our devices. Are we starting to see more people diagnosed with mood disorders now? Are we seeing an uptick because of technology and things like that, or just the way people maneuver in families these days?
We're still figuring that out. Among young adults, there's a dramatic uptick in anxiety disorders, also seemingly an uptick in mood disorders and suicidality among young adults relative to prior generations. And everybody complains about today's kids relative to the kids they remember being. That withstanding, there seem to be some qualitative changes that we're inclined to link to technology use as being used as an alternative to face-to-face interaction, these kinds of discussions. There's a lot left to learn.
And I would also say that when it comes to technology, just that intergenerational contact and that engagement, it can be very helpful. There are students who go out and they work with older adults and teaching them how to use their Facebook or their FaceTime, and that was really critical during times of COVID, where we couldn't engage face-to-face. Technology definitely has its place, but we also have to keep in mind how it can hinder older adults and can be intimidating as well. So just finding a happy balance and incorporating technology or helping to kind of bridge that gap with isolation through that method can be very resourceful.
Yeah, and during COVID lockdown, actually, as a neurology, we all moved into Zoom clinics, right? We were all online trying to follow up with our patients. And within 3-month period of the lockdown, I could say consistently, no matter what was the condition that I was following the person for, the common complaints were physically they were deteriorating, weaker, worse balance, emotionally, mentally. The patients that I had with memory problems, they were all deteriorating because they were no longer seeing their friends or their church friends. The degree of interaction and mental activity was so limited versus the normal way we were living. And still outside the lockdown situations, we know sedentary life, physical and mental, can contribute to more mood disorders, more dementia, and even the patients that have other neurological conditions are also affected by the lack of physical and mental activity. So yes, it's important.
Yeah, that Zoom calls are no substitute for a hug from grandma.
That's right.
Correct. Mm-hmm.
Well, Dr. Paulson, Dr. Jennings, and Dr. Baez-Torres, thank you. We have more information coming up, so stay with us. Welcome back to this episode of Vital Living Forum, where we're talking about mood disorders in older adults. And joining me are Dr. Daniel Paulson, Dr. Ashley Jennings, and Dr. Sheila Baez-Torres. Welcome back to all of you. I want to start off this segment talking about how mood disorders can impact the quality of life for older adults and how it really can change the way they experience living at different ages as they get older.
Sure. So on our list of 9 depression symptoms, the second one is loss of interest in pleasurable activities, and then on down the list we have loss of libido, disrupted sleep, loss of appetite, weight gain or weight loss. And so these factors in combination really erode a person's ability to engage in the kind of meaningful, enjoyable activities that create value in our lives and would, on a better day, prevent us from feeling depressed.
Absolutely. I think that when older adults experience a level of just helplessness and hopelessness, that really impacts their quality of life. I think that it changes the way that they interact in the world. It changes how they feel about themselves, their self-esteem, and it really can make them doubt themselves. I think that that's a challenge for them, and even how they're able to engage their families, and their families start to notice when they change, and oftentimes they may not be aware of it unless they're having that direct or consistent engagement with them, but it really can take them away from their families, their friends, and allow them to just go into a place where, you know, we need to get them back and to recover them the best way we can.
It could be a spiral, right, where you may not have the energy to exercise, you may not be as compliant with your medical care and medical treatment, or let's say diet, somebody diabetic may care less, may go in binges, right, on the wrong type of food, just looking for that comfort that they need and they perhaps don't know how to ask for, or they don't know where to look for it. So certainly it can impact their medical aspect as well. We know depressed patients, their hospitalization stay are longer. Their overall prognosis for different medical conditions do get worse at different levels, whether it is cancer or Parkinson or neurological behavior-related conditions. So it can definitely impact at many levels.
And you mentioned, you know, weight loss, weight gain, all those things. Are there concrete warning signs that friends, family, neighbors would be able to see to say something's not right here?
Sure. Some of the most noteworthy things you'd keep an eye out for are lack of attention to grooming, lack of attention to personal daily habits. Might be a little bit more difficult for a friend or family member to catch, but negligence toward medical care, taking medication on a regular basis, going into doctor's appointments, all of these things are often seen among older adults with mood disorders for the simple reason that there seems to be little reason to go to the trouble to prepare a good meal. There seems to be little reason to go find the medicine, go all the way to the pharmacy to get it refilled, when in fact those treatments may be very necessary for their well-being.
Any other warning signs that stick out to you?
I wanted to twist it a little bit into what else could it be, right? It could be an early sign of something else. For example, we know that mood disorders, particularly depression, is associated with higher risk for dementia, and they share common risk factors by age. Definitely Alzheimer's disease being the most common type of dementia. 65 and older, that's the #1 risk factors. Take aside family history, but again, depressed patients not taking care of themselves. For Alzheimer, from the Alzheimer's standpoint of view, uncontrolled diabetes, uncontrolled high blood pressure, cholesterol, sedentary life, physical and mentally, everything kind of comes together. Vascular risk factors. In the neurology side, we sort of believe in what we call vascular dementia, but also vascular depression, right? It can happen. It could also be depressions due to their medical issues, comorbidities that are just overwhelming to them. So there's a lot to it.
I wanted to add with what Dr. Paulson said about risk factors. When we see older adults that are participating in gambling, or we see that older adults are being taken advantage of, they become more vulnerable. All of those things we have to pay attention to. You know, financial abuse is a problem. And so we really have to monitor how older adults are navigating and if they are able to still have ownership of, you know, things that they've done, their quality of life and just their ADLs, their everyday activities and things of that nature.
I wonder, how do you then, when you start to see these signs, how do you start that conversation? Start having those that can be tough conversations with someone who considers themselves independent, doing their thing, and really talking to them about seeing someone. If you've done your homework and found treatment options, where do you begin?
For me, there are kind of three primary messages. And the first is to address this issue of depression as a life stage, something that we may experience, and in fact, most people do at some point in their life. Everyone has those bad days, and for some of us, they can drag on for quite a while. And then the second is to encourage the person to seek treatment by expressing confidence that the future can be a better place, and they have the resources and opportunity to make that happen through their own action. And then the third, the seeking treatment part, with older adults in particular, this can be difficult. Often there's a sense of the mental health system that is based on perceptions of psychiatry, inpatient psychiatry from 70 or 100 years ago. Patients went into the asylum and perhaps stayed there for very long periods of time. No longer the case. And as a clinical psychologist, a lot of the services I provide patients can be looked at in much the same way that you would look at the services provided to you by your family's accountant or whomever works on your car's transmission, or professional services provided by people with specialization in that area.
Communication is very important. Empathy is very important. Having conversations where you are empowering that person, not blaming them, or just accepting what they have to say. And I think oftentimes when we need help, when we really need to talk to someone, we don't want to be judged. And being non-judgmental is probably one of the first ways that we can make sure we can have those conversations.
I love your answer. I was going to say, ask. Don't be afraid of asking the tough question. How are you feeling? What's going on? Let them talk. Be a good listener as well, right? Because not giving them the opportunity to express their feelings, but jumping in, judging, or giving them the entire shopping list of what they need to do next, that's going to make them feel the need for avoiding talking about it. I mean, something we haven't mentioned is there a possibility for substance abuse, alcohol especially? Males have more tendency to become more irritable, go into substance, alcohol in particular, versus women that stay more quiet, more tearful, so on. Looking for opportunities to learn, like these education opportunities, to always keep that conversation going, the opportunity to learn so they can hopefully understand themselves, have that insight of there's something off here, bringing again the possibility of other conditions at level of clinical research. We love do baseline memory screening. We have studies for depression as well, so baseline mood evaluations. That happens as well at level of primary care offices, health fairs, sometimes church, social workers. Online, we were talking about online negatively, but I also want to bring the positive side of how easy it is to get so much information online and request help if needed. So it's just staying connected and bringing something for that person to be involved while they go through that. Even if it's helping with laundry or doing little tasks, whatever it is, go for a walk, go get your mail outside. Anything is something, right?
And I would add spirituality and religion plays a very important role as well. A lot of older adults are very connected in that way. It is a place or church or wherever they worship is somewhere that they want to be or that they trust the individuals there. So it's a community. And I believe that is definitely allowing them to still express how they feel and connecting to their spirituality will help.
Dr. Paulson, Dr. Jennings, and Dr. Baez-Torres are coming back with more. Stay with us. We'll be right back. Welcome back to this Vital Living Forum about mood disorders in older adults. So far, we've talked about common mood disorders, the warning signs, and also how mood disorders affect the everyday lives of seniors. And we are still joined by Dr. Paulson, Dr. Jennings, and Dr. Baez-Torres. Welcome back. So let's talk a little bit about treatment options. So if we have had those tough conversations and we can see that there's something that is profound, not just a bad day, what are the options for treatment that our loved ones may face?
Sure. So in clinical psychology, we have 60, 70 years of very good evidence, scientific evidence on what seems to work for people with depression. And over the last few years, that literature has kind of converged on a first-line intervention we call behavioral activation. This basic idea is simple. It's one of reintroducing those enjoyable activities, meaningful activities, reintroducing neglected relationships that again try to create meaning and value in the life of that individual. On paper, it sounds really simple. Conceptually, it is. But when we feel depressed, the instinct to seek those things out tends to go away. And there are often a lot of barriers to work through, and a good therapist should be able to do that with a patient. We've got a couple other interventions that are especially useful with older adults, even those who may have some memory impairment or be homebound for one reason or another. One of my favorites is something called reminiscence therapy, which involves creating a biography, or an autobiography rather, based on one's own photographs, one's own stories. It can be done by recording stories in one's own voice about how they grew up, what their life was like as a child, their first date, what the party after their wedding was like, what their first 3 jobs were like. Pick a topic. And kind of building that legacy, so to speak, through pictures and photographs, video, story writing. There are lots of ways to approach the task. But it has a way of shortcutting that kind of brooding rumination that accompanies depression and redirecting our memories more deeply into the specifics of our own narrative and our own background. Helps us gain some perspective on how we got to this point in our life. And for a lot of older adults, it creates this portfolio, this story that can be given to others in their family.
I was going to say, it's an amazing archive for generations to come.
It really is a gift.
It really is. Mm-hmm. Any treatment options that you come to mind with you, Dr. Jennings or Dr.?
Well, in general, the options in terms of pharmacology, right? Medications are endless. And with time, we are receiving better and better medications with less drug-to-drug interaction, more specific drugs that can be used to cover different medical issues. For example, we know that some antidepressants are very good for headache prevention, for pain control, for patients with neuropathy. So we try to customize at that level what would be the best treatment for that particular person, also depending on the age group, because some medication may be more sedating than others, right? We're trying to avoid anything that could cause addictions or dependence. We see patients that go more to the emergency room complaining of GI complaints or headache. Workup is constantly normal, and it's because it's what we call somatization, right? It's the physical reflection of their emotion, whatever emotional pain or situation they're going through. So when we get this $1 million workup that is all normal, whatever medication attempts you try, nothing works, consider mood disorders, because sometimes that's the source of the problem. Changing, again, twisting it to my side, our Alzheimer's disease. When we see that the early manifestation of Alzheimer's disease has to do with mood disorders or any other of the typical presentation, personality changes, memory, you name it, my goal is also to let them know that we have learned so much about Alzheimer's disease, that we have blood tests that can actually check if they're at risk, if they're developing the changes in the brain. We call that biomarkers, blood markers, where some abnormal proteins that build up in the brain years, decades before Alzheimer's symptoms develop. We can detect it by technology, imaging, blood tests, and the new generation of treatment for Alzheimer's disease, what they do is they remove these abnormal proteins so we can slow down the progression of the disease. So that's available already, and we have that at research level here in Orlando and everywhere, really. And same for depression and other mood disorders. There are plenty of opportunities at the research level. That means voluntary, free workup and treatment for everybody. So the opportunities are there, and they should be hopeful to get involved and look for the answers and find their solution, not to sit and just go in spiral over their situation.
And I would love to add music therapy and art. Music, it has such a protective factor. We remember music that we love. You remember a song that you've heard, you know, or just drawing, coloring. All of those things are really therapeutic. They have a profound impact. You know, we see older adults who may have enjoyed playing instruments, and allowing them to do those things that bring back positive experiences or memories for them and allow them to be active. Really great for them.
I want to ask a question for, and it's not just for doom and gloom, but more to see what happens if someone doesn't get treatment for a mood disorder. What can happen to them, the family dynamics? How does that impact?
Sure. So with major mood disorders, they tend to be rather episodic, and there's a high rate of relapse for people who do not seek treatment. Because whatever created the mood disorder in the first place, often those factors are still very alive in the person's life. Good therapy helps us to find creative ways to problem solve around that and to make the world that we live in a slightly better, more enjoyable place. So that being said, the other side of that would be the risk of neglecting healthcare, neglecting well-being, neglecting relationships. And we know that depressed older adults actually don't live as long as older adults who are in a good mood. We know that depression is a risk factor for falls, emergency room hospitalization, as the doctor mentioned, disease by a very large number of factors, cancer risk. I could keep going. But nothing works quite as well when we're depressed. And when you're younger, middle-aged, those disparities are somewhat slight. As we get older, they become quite exaggerated.
Absolutely. The relationships are really important. Caregivers are impacted when their loved ones experience mood disorders, depression specifically. It really changes the dynamic of the family and how they interact. It can really sever those ties and really create a challenging family dynamic. I think as a caregiver, when you have a loved one that is experiencing depression or isolation, they're removing themselves, it really makes it difficult to provide them quality care. It makes it challenging to communicate with them. And so understanding those issues as well and being able to overcome those barriers are really important. And also just trying to make sure that, as we mentioned before, communication.
And Dr. Baez-Torres, you mentioned some of the advancements that are happening in treatment of mood disorders. What are some of the resources that are out there? So if you are experiencing this with a family member, with a loved one, and you want to find out more information, where should someone go?
Well, at research level, I'm part of the medical faculty of K2 Medical Research. We have multiple locations: Tampa, downtown Orlando, Maitland, Winter Garden, the Villages, where there's so many senior citizens, right? These are hotspots for these possible patients. K2med.com, 407-500-5252, online, church, friends, neighbors, family, any resource could be a start. And maybe you don't know, or the person next to you doesn't know, but they know somebody that may know. So I think asking is the beginning of everything. I was gonna say, there's nothing harder than being a caregiver, out of question. And then it becomes this crazy cycle where you have somebody that is depressed, not doing well, maybe showing irritability, lack of appreciation to that caregiver. And of course, that caregiver is gonna feel down and frustrated and drained from that. And it snowballs, right? And we're talking about elderly, but overall society at all ages. Look at the society, how prevalent depression and sometimes violence is around us. The risk for suicide definitely goes higher. So there's a lot that could happen when we don't take care of this situation as soon as we can.
Dr. Paulson, Dr. Jennings, Dr. Baez-Torres, thank you so much for sharing this information and helping us to understand mood disorders in older adults.
It's a pleasure.
Thank you very much.
Thank you all for those touching stories and those valuable resources. Mood disorders in older adults can sadly go undetected and untreated, largely due to false beliefs that with age it's normal to have a mental health problem. Well, that's not the case. Mood disorders at any age can be effectively treated, and our hope today is that collaboratively we can continue bringing awareness to mental health for older adults through education and access to mental health care. We hope you have learned as much as we have and walk away with valuable information and resources.